This is a problem of stasis eczema or stasis dermatitis. You can see this patient's leg is very dry and scaly, and there is some discoloration in the skin. He also has some open, weepy places. This is a serious problem if you don't get it under control, as you can develop leg ulcers, which are in turn very difficult to correct. Stasis eczema develops and a lot of times with poor circulation, and also heart disease and blood clots and varicose veins can make this more difficult to treat. The older you get, the more it is difficult to treat also. Leg ulcers can become a major problem. The most precise method of treatment for stasis eczema is to stay away from soap. Soap is an irritant to the skin. Warm water, Gillette foamy shaving cream, or a soap substitute is better to wash the area with than soap. Soap can irritate and actually kill new skin cells trying to form, so a soapless cleanser like a foamy shaving cream is better, and to keep soap totally off of the area. In using a soapless cleanser to cleanse the area, foamy shaving cream or another soap substitute is recommended. Even sometimes foamy shaving cream can be too irritating. Always call and let the doctor know, because there are several alternatives to use. Alright, we have developed the 30-30 rule that is a way of helping promote circulation and getting blood flow to the lower extremities. For any amount of time you need to be up, you need to take 30 minutes, put the feet up above hip level, and rest for 30 minutes, then get up and do whatever you need to do for 30 minutes, and then sit back down with the feet up over the hip level for 30 minutes. Another way to increase circulation to the lower extremities is just a brisk walk around the neighborhood. What you do not want to do is stand for long periods of time or sit in a chair with the feet dangling. Anytime you can put the feet up is beneficial to circulation. Speaking of blood flow, your primary care physician may need to evaluate your circulation. There are medications that can be taken to increase circulation, like Trental is one that increases circulation in the arteries, and you can discuss any other medications with your primary care physician. So the key to getting the stasis eczema better is to exercise and to get some, like walking is the best for that, to get the blood pumping. Also the 30-30 rule that was explained, and keeping the feet up for every 30 minutes that you need to be up and moving around. Also keeping the soap, again, off of the skin, and watch for infection. Any tenderness, red streaks on the leg should be reported to the doctor immediately. Avoid things like Neosporin, lanolin, vitamin E. Always make sure to only put on what the doctor has recommended for the areas. In addition to the 30-30 rule, when you have your feet propped up for the 30 minutes, it's good to get a wet, moist, slightly warm towel and wrap around the area. Apply the warm, wet towel for 20 minutes 3 times a day. There are also steroids used to treat stasis dermatitis, hydrocortisone, dexamethasone, clobetasol, and several other steroids that can be used to help dry this up. It depends on, everybody is different, and your problem will be specific to you. The creams, lotions, ointments that we use depend on what degree of stasis eczema you have. If it's really oozing and wet, you would more need a solution, which is the vehicle that the steroid is in. Once it starts drying up, you may need a cream or some kind of a Vaseline type ointment. The steroids used, whatever the doctor prescribes, should be applied after you have done the wet warm soaks. The cortisone cream or prescription cortisone or steroid cream that the doctor prescribes needs 6 to 8 hours to be effective to the skin. So you should soak and do your warm wraps first to soften and moisturize the skin prior to putting on whatever steroid the doctor has prescribed.